over 1.3 million people got a letter, a lot of them didn't read it, telling them that their Medicare Advantage plan was leaving the county for next year. Now, that's nothing personal. They're not doing that because I had a heart attack and they want to get rid of me. They're getting rid of the plan that I'm on in my entire county. Everybody that's on my plan will get that same letter. So don't feel like it's personal. Why are they doing that? They are for-profit insurance companies. A lot of people think that insurance companies are charities and they do what's right for the American people. No, they are for-profit corporations. Even the non-for-profit corporations are really for-profit corporations. So it's all about money. If your county wasn't profitable for them, they can leave the county. They're allowed to do that. Now, what happens if you didn't read the letter? If you don't read your mail, you didn't look at it, then you will find out surprisingly next year when you finally go to the doctor and the doctor tells you, oh, you only have government Medicare A and B. And you're like, no, I have a Medicare Advantage plan. I've had it for years. They're going to say, no, it terminated December 31st. You might find it out when you go to the pharmacy that you no longer have a drug plan. And that's when you call and you panic. So you still have all of January and all of February to get a new plan, but while you are trying to get the new plan and they only start on the first of the month, you will not have anything other than government Medicare A and B. So you will have out-of-pocket costs, co-insurance, and you'll have to pay for all of your medications until you get your new coverage. So you still have until December 7th. The annual election period ends December 7th if you want to just change your plan. But if your plan exited, if it left, you want to know that. You want to know, did my plan leave or not? Don't assume that you're not one of the impacted people. You can call your insurance company, get your ID card, flip it over. There'll be a customer service number. Call them and ask them to send you your annual notice of change letter. You could technically ask them if your plan is terminating for next year. I don't have a lot of faith in the quality of customer service you're able to get anymore. You could try that. And if they say, no, your plan is definitely re-enrolling, write down who you spoke to and the day and the number, because if they gave you wrong information, you can rely on that to get help later. That's why I said it's probably better not to ask them and expect them to give you an accurate answer. It's probably better to ask them to send you in writing, they can email it to you right now, your annual notice of change letter. And if you help your parents or another family member with their Medicare, you want to look at that letter, because if it says your plan is terminating, you don't have to abide by the December 7th deadline. That's for people that just want to change their plan. Your deadline is actually December 31st. So you have a whole month left to get that done. But you need to know what's changing with your plan. Now, if you want to just change your plan because there's something you no longer like about your plan, maybe your doctor's no longer in the network. Maybe your hospital's no longer in the network. You have to make that change by December the 7th. And that's quickly approaching. So look at your plan and see, is it good enough to keep for another year? For most people, they don't want to change. It's not worth the hassle to change. To re-enroll, to get the new ID cards, to get signed up on the new portal, to figure out how to use the extra benefits, it's a lot of work. So most people, they know the prices go up a little bit every year. They expect that, and they don't have any major upheaval. So they just let it auto-enroll. You don't have to do anything. Unless you got that letter saying your plan's terminated, your plan will automatically enroll into a plan for 2026. You will get new ID cards in December. You'll throw away your old ID cards and you'll continue for another year under the new plan, which I said there's always slight modifications. Prices, typically they edge up a little bit here. What matters most to most people is the monthly fixed cost, the zero premium that Medicare Advantage is famous for. In most cases, 95% of cases, if your plan had a $0 premium for this year, it will continue and have a $0 premium for next year. A lot of people don't look deeper than that, but trust me, most plans are going up somewhere. So it's not going up on the monthly cost, but how much to see a doctor might have gone up. How much if you have an inpatient surgery might have gone up. So look at your plans and know medical inflation is through the roof, right? It's off the charts. So your plan very likely went up somewhere, somehow. Maybe you're healthy. Maybe that's not really a risk to your budget. You don't really feel like that's going to impact you next year. Sometimes the doctor copays actually went down, which is always a wonderful surprise. The main thing is you need to know that if your plan exits, you have until December 31st to make that change. If you forget to make that change, you can do it in January or February. But if your plan's not exiting, you just want to change plans for some reason, your deadline is midnight on December 7th, this year and every year. If you have questions, email us in the comments. Give me a follow, a like, or share. Your friends are all about your same age. Let them know Medicare Family can help them in all 50 states. Our help is free. We're paid as independent contractors by the insurance companies. Thanks for watching. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.